Well, actually, modified FOLFIRINOX is very largely used around the world and is considered as a standard of care. So this was one of the best options we can compare in this context. And the other regimen is used at my institution since 12 years. So we tested this regimen, the PAXG one, against nab-paclitaxel gemcitabine in a phase II trial in stage 4 and in stage 3 disease. And we observed an increase in 2-year survival rate that was doubled with this regimen. Accordingly, we thought that this was the best candidate to be tested even in the context of neoadjuvant. I think in the context of the population we have considered for this trial, the largest unmet need is a cultural perspective, because we continue to use a surgical resectability classification that has never been proven to have a prognostic value and is not reproducible. So I think this is one of the main obstacles to progress in this setting. So we have to think that resection is not the cure in this kind of population, because more than 96% of cases have a micrometastatic disease in this setting. So of course surgery is not the answer. We need to start with considering this patient in a different perspective. In our trial, I did not show this data yesterday, but in our trial there is a multivariate analysis showing that the surgical resectability classification is not related to prognosis. On the other hand, AJCC classification, so the TNM classification, is related to prognosis. So we have to use this kind of classification and start with chemotherapy for a systemic disease. So I'm afraid that we did not observe any relevant advance in the last 5 years. So maybe the best options we have observed are from the strategical perspective. So there is now mounting evidence of the differences in terms of survival when we use different strategies like neoadjuvant therapy. So I think that in a context where we have limited options for treatment and no new relevant treatments, we need to use better the scarce resources we have. In the future, of course, we are waiting for the results of new agents like RAS inhibitors, maybe, or like immunomodulators that failed until now in this context, but we may expect that we are able to better use this kind of agents in the future. So I do hope that this may change the scenario.